right, we'll have you covered. Well, coping with medical issues is tough enough, but imagine it from the perspective of a young adult. A new intensive mental health program in the state is helping those young adults between 17 and 26 years old. Here to talk about that is Dr. David Bendor, clinical coordinator of the Young Adult Services Medical Track at the Institute of Living. Doctor, welcome.
Thank you for having me.
This is such an important topic. So your program is very unique. We understand there is not another one like it in New England. Tell us about it.
Yeah, it is quite unique, and what programs in New England do and throughout the country. There are plenty of programs out there treating young adults with mental health conditions. Where we're unique is we're looking to treat young adults who are struggling with both the mental health conditions and co-occurring physical health conditions. And those are physical health conditions such as diabetes, Crohn's disease, cancer, seizure disorders, chronic pain, to name a few.
All right, why is a program like this so important?
You know, just the other day I was telling some colleagues about our program, and a physician friend came up to me afterward and said, Dave, this program is so important because of advances in technology and medicine. We're helping these young people with conditions that 20, 30, 40 years ago, they just would not be surviving. And now, because of the advances, these young people are surviving and have a real chance at life. But these medical conditions come with hosts of problems, and programs like ours can help us manage those problems.
That's really good news. So what are some of the mental health challenges that your patients may be facing?
So typically with the young adult population, we'll see the diagnoses of depressive disorders of some sort, anxiety disorders. With this population, we're finding they struggle quite significantly with trauma and related disorders such as PTSD. Because if you think about it, these are young people who often at a very young age were given very scary, very frightening diagnoses. And then the treatment afterwards was very impactful. They could be extensive surgeries, numerous surgeries, and significant physical rehabilitation. And those experiences, while life-saving, are definitely traumatic and impactful.
Oh, that's so heartbreaking. All right, who is a candidate for your program?
So we're looking for young adults who are struggling with these co-occurring conditions. So they're struggling with mental health conditions, and they're struggling with some of those, aforementioned medical conditions. Kind of the shortcut way of thinking about this is we're thinking of young people whose physical health is exacerbating their mental health, and whose mental health is exacerbating their physical health and their ability to care for themselves. We're looking for young people who've really been derailed in life, and due to those conditions, they're struggling in school or work, and we want to really help them get back to doing life.
All right, Dr. David Bendor with the Institute of Living, thank you very much. Great work.
Thank you for having me. Thank you for having me.
Thank you for being